Welcome back to talk about the amalgamation of the local public health units into the Southeast Health Unit. I'm talking with the medical officer of health as well as the CEO of the Southeast Health Unit, who happens to be Piotr Oglaza. Did I pronounce that right? Or am I getting closer? So, Doctor, please tell our viewers what and how many of the health units, the local health units, are comprised of the Southeast Health Unit.
Yes, thank you very much for the opportunity to speak to your viewers. It is my pleasure to be in this interview and maybe speak to some of the details about this, the plans and the new entity. So to answer your question, there are three former health units that now comprise of the Southeast Health Unit. That's Leeds Grenville Lanark District Health Unit, KFLA Public Health, as well as Hastings Prince Edward Public Health.
So there's no closing of any of these agencies, right? There's no closing whatsoever. Not at all. Now, the location of the Southeast Health Unit actually is in Kingston, right?
So when we, I'll just go take a step back to the earlier point about there's no closure of any of the health units. So when we think about this amalgamation, this merger, someone explained it really well to us was the lawyer who was assisting on the legal side of things, was saying that this amalgamation is not really that any of the entities stops and the new one starts. It's more like the analogy of the three streams joining together to form a big river. So we're down now this bigger body of water, bigger river that now is continue to flow, but all the three streams are now part of this one larger stream happening that we call Southeast Health Unit.
And so what is happening there is that they are still functioning as they did before. Yes?
So yes, so the at the beginning, I think one of the important message to the public that people might be asking or wondering is that how am I going to connect with the health unit staff that I had connected before?
Right.
There are public health inspector coming to do inspections, public health nurses going to do the healthy babies, healthy children visits at homes. That is all going to continue. The same phone numbers are in place, the same email addresses, methods of contacts. Eventually, that's something that's going to then take a form of the new corporate identity of the Southeast Health Unit. But currently, we want to make sure that there's no disruption of service for people receiving services. And the same staff, the same email addresses, the same phone numbers until instructed otherwise, will be still in use to connect with our services.
Which is awesome. You're trying to make it as seamless as possible, aren't you?
Yes. And I think that's the distinction between what to expect in the short term, midterm, and long term. Long term, we expect the larger entity will have greater capacity to take on any of the emergencies or surges in demand. So that's the long term goal, and that's really what was the recurring theme from the 2003 SARS crisis that happened in Ontario, and this is something that there were 20 years of reports that pretty much said that the health units should be larger organizations that have greater capacity to then respond to this type of surges, and then the measure of that capacity was the goal, the target, how large the health unit should be is based on the population served. So there's good evidence to show that organizations that are large enough to serve between 300,000 and 500,000 population have that optimal size and capacity. And that was the target by the province when we were offered this opportunity to engage in the discussions about the voluntary mergers. That was one of the parameters. The population served. In our Southeast Health Unit, we already are over that 500,000 mark, which is, again, the optimal size of what we can then accomplish down the road as that large organization with greater capacity.
Which is, it's our viewers have to realize it's going to be to their benefit in the long run, because even though we have a lot of programs here locally, I mean, there's other programs that will be introduced in the future. Yes?
So so that's a parallel process that is happening in parallel to the voluntary mergers. So when the province first announced the opportunity for public health units to come together and entertain this voluntary merger, submit business case, and follow that process, there was also other parts of that strengthening of public health initiative, and that was the review of the Ontario Public Health Standard, which is basically a document that says what kind of services are being offered. Our public health units have to offer in the community. So that's a separate process. So that's something that's a different line. Now, as far as the existing services and the vision for improvement down the road, it's really about making sure that these services are distributed equitably. So especially thinking of people residing in the rural areas, we know that they already have experience challenges in accessing services. We know that even in urban areas, there's challenges accessing various types of healthcare related services. We know that there is a crisis in terms of access to primary care. While we offer different types of services than primary care, but the same concepts apply. We want to make sure that population is well served and these services are strengthened as a result of this merger. We have now greater capacity, more staff. We are not more staff, but we have larger teams, which means that if there is a disruption in one area, we can potentially fill that gap by temporarily redeploying people. I think that's a really good point as well. It addresses the issue of that critical capacity. So one of the examples I've used before is as part of the role of local public health is to look at the health of the population. And we need specialized, highly skilled individuals to do that type of assessment. We have epidemiologists, for example. And then each of the health units has to hire their own. And yes, there's work across the three organizations. There's work for all three. But if one, in the past, when we had three separate entities, one would transition to a different job, moved, was on leave, the different reasons why people may leave their positions, that one entity would be short.
Right.
Now, as a large organization, now we have a bigger team, and that team, there's still plenty of work for that. But temporarily, we can cover for each other much better, much more effectively and efficiently than that it would have been in a situation where we are separate entities. I think that's a really good how that greater capacity. A team of three is more resilient than three separate teams of one. And I think that's really at the bottom of what we're trying to accomplish with this merger. That's the whole reason and rationale for larger organizations.
Which I fully understand, and I'm sure our viewers do too, because I mean, there's more collaboration that's going on, and sharing of information, which is a good thing. It's a good thing. You're not just all by yourself on an island. You actually have other people that you can go to and and collaborate with them and come up with solutions that are needed. So right now, what the Southeast Health Unit is doing, you're doing more of the legalities, you're doing more with logos, branding, you're just trying to get everything all smoothed over as to who you are. I mean, there's not a lot of changes that will be coming out right now, correct?
That's correct. And that's one of the goals of our plan, our process is to, anytime when you think of the magnitude of change that we are implementing, that's a huge disruptor for any organization. And now we have three organizations joining together. So it's a huge factor in terms of disruption. But our goal is to make sure that the services at the front at the front lines and in the community remain uninterrupted. And I think that's so we don't necessarily expect significant improvements in the early days of this or months, but what we want to, it's going to be a measure of success is that when we, despite doing all that work in the background in terms of the legal mergers and all that disruption to organizational structure, that we still are able to deliver uninterrupted service to the communities. That's the goal. That's absolutely, it's a must. And then we built on that in terms of improvements. So no, as I mentioned, no changes expected for individuals receiving services, the same numbers, the same offices, the same staff. most part will be providing services. And if there's changes, I mean, these changes might be just like any other changes if there was no merger, like
Right, exactly.
people can transition. So there might be minor changes that would have happened regardless of the merger, but we want to make sure that it's as seamless as possible.
So in the past, we've usually talked with Dr. Lena Lee. So I understand that she has a new role now. Dr. Lee has a new role, yes, and that will be.
So that's part of the goal in this transition is to make sure that there is stability and the same level of local connection. So we want to make sure that medical officers, even though we take on a number of administrative roles, these are the frontline position in terms of the specialty of public health and preventive medicine. So these are the physicians, the roles where we look at the health of the population, we make connection with the community partner agencies. And we do provide that guidance to staff, and that is essential. That while we increased in size and now have a large organization, we're benefiting from that larger size, but we don't want to lose what was the strength of each of the individual health unit, which was that local connection. That local connection, partially, very importantly, built by the presence of medical officers, medical professionals, public health preventive medicine specialists, and there will be also they'll still around. They will be providing that support to municipalities, to healthcare partners, to staff in those offices and areas, and that's really key to ensure that there's stability as well as that local connection remains.
Yes, which is awesome. Is there anything else that you would like to tell our viewers about this amalgamation and what it means in the future?
I think the important part about the amalgamation is that the benefit of that amalgamation and the benefit of that increased strength and capacity and surge capacity, that's something that if all goes well, the public may not necessarily see, because if we don't have another emergency for a number of years, we may not really fully appreciate the benefits of this. But it is something that gives us that extra layer of protection, extra layer of capacity in case we were faced with another emergency. And sadly, we know that. I like the situation where we don't have another pandemic for decades, but we know that this is the emergencies or response that the just the fact of life. They will happen. There might be different reasons for those, but we will be better prepared to handle those as a large organization serving larger area. We'll still maintain that local connection while increasing our capacity to respond. And I think that's really something that I want to convey to the public, is that most of the time when public health does the work, people don't see the outbreaks prevented. People don't see the diseases prevented through vaccinations or other ways where we work with the public, when we provide support to families, children are developing healthy and well. That's not something that generates the headlines, and we hope we're fine with that. We're happy not to generate the headlines. We're happy to generate this no news type of environment. But we also recognize that sometimes there are external emergencies that are coming into our area and impacting our area, and for that we want to make sure we are well prepared and have organization that's now resilient. I think that the design, the system, that greater capacity is going to achieve that. So that's really the goal, and I'm hoping that the public will be patient with us as we are building this new improved system where we have that larger organization. There's going to be some hopefully minimal disruption all the way, but I'm really asking everyone to recognize the magnitude of this change, and I think the viewers from Leeds Grand Lanark District Health Unit probably may remember that this entity, the legacy LGL, was founded in 1947. So we've had decades, and this is the transformation that's hasn't happened and transformation of this magnitude hasn't happened in decades.
Yes.
And that's really what we're building. We're building something that will be setting us up for the future for decades, if not generations. So that's really something that we're all very passionate about, and we see the benefit of this. And I'm really hopeful to bring that as soon as possible. But please give us a little bit of room so we can do that work behind the scenes and then bring something much more resilient to serve the communities.
Thank you very much for talking with me today. I'm sure our viewers are appreciative of you taking the time, because I know you're very, very, very busy, and we appreciate it, of course. And yes, we don't like change, but sometimes change is good for us, isn't it? Thank you very much, Doctor. We really appreciate it.
Thank you so much for having me.
Thank you.